Hi, I'm Dr. Sulata Shenoy, psychologist and director, Turning Point, Center for Psychological Assessments, Therapies and Counseling, Jayanagar, Bengaluru. If a survivor of child sexual abuse grows up without resolving the deep-rooted issues of the abuse and the aftermath of it, it is very often likely that the person may develop a stunted personality, have inadequate ability to trust and not able to form lasting relationships with others. And this would affect the person at work, in the family and at society at large. Now, due to the very nature of childhood sexual abuse, which by the way is fairly common, and though the statistics reveal that there is a significant number of children who undergo child sexual abuse, still I would say that it is just the tip of the iceberg, because many go unreported just due to the shame, the guilt and the feelings of inadequacy that are associated with the very act of childhood sexual abuse. And very often the perpetrator is somebody who is known to the child. So very sadly it could be within the family, and that is why families also tend to hush it up, do not allow the child to express it or even acknowledge it, leading the child into a maze of confusion, self-loathing and guilt and anger, which can very easily get displaced onto herself, her own body or to others. Now, childhood sexual abuse is equally common among boys too, but it is more often in girls that we find the aftermath or the trauma that remains, and may also lead to unfulfilled marital relationships. So, if a spouse of survivor of childhood sexual abuse is vigilant and can understand and be empathetic of what his wife has gone through, the whole recovery process can be brought about and healing can be completed later than never. So what the spouse needs to do is allow the person to acknowledge it. One must remember that the person may have suppressed or denied these feelings a number of years and may have had very dysfunctional coping strategies such as outbursts of anger, outbursts of self-mutilation, self-loathing, very poor body image, very poor self-esteem, inability to have close relationships with anybody, nor to hold stable jobs or any kind of the normal functions which we associate adults to do with. So the person may be binge eating, may have eating disorders, may have sleep disorders, may have somatization or aches and pains all over the body, and may be excessively unable to keep to himself or herself either socially or within the family, leading to very serious difficulties in socializing. So the spouse needs to understand that, first of all, get the survivor to express what has happened, acknowledge it. I think acknowledgement is the most important thing which was denied to the survivor of childhood sexual abuse, because very often we tell the child, no, it is not true, the uncle wasn't so bad, maybe you misunderstood, or maybe you asked for it, or maybe you are in some way to blame for what has been done to your body. So many times we make the survivor feel ashamed and guilty, and the first thing is to acknowledge that the person who did it is at fault, and the child is not at all in any way asking for it or not at all responsible for what was thrust upon her or manipulated into doing. So acknowledgement, and secondly empathy, and letting the person vent out feelings such as grief for the loss of innocence in childhood, loss of feelings of closeness, and a whole host of anxiety and anger outbursts may occur, which are to be expected. And the spouse has, in addition to get the person to go closer towards therapy and closure, probably initiate counseling for the survivor, which will very often be denied, or the person says, no, I don't need it, or it's too late, or nothing can be done. But counseling with a good psychologist can heal the wounds of childhood and can make the person whole again. And the spouse has to remember this, be supportive, take the person for therapy, and be there during the counseling process, as well as be with the spouse so that the recovery and healing will take place gradually but certainly.